Our next genitourinary condition is acute glomerulonephritis. This is inflammation of the glomeruli, usually after a streptococcal infection. Kids can have cola-colored urine from blood, foamy urine from protein, swelling around the eyes, and high blood pressure. Think of the glomerulus like a coffee filter. It's supposed to keep big things like protein and blood cells out of urine. In glomerulonephritis, the filter gets holes, so the big things, protein and blood cells, can leak through into the urine. In addition to hematuria, blood in the urine, and proteinuria, protein in the urine, urine can appear concentrated because of decreased urine output. Basically, the kidney's not functioning like it should, so it's not producing urine like it should. The patient may be irritable, look ill, be lethargic, not wanting to eat, anorexic. They may describe vague discomforts. The edema a lot of times will be on the face, so periorbital, around the eyes, and facial edema. Hypertension we talked about, and they may also have a low-grade fever. So why hypertension? You sort of got two reasons here. One, if the patient is holding on to fluids, that's going to make the blood pressure go up. And also, if the kidney is not happy for any reason, we worry about hypertension in the patient. Diagnostic for acute glomerulonephritis include urinalysis, which will show protein and blood in the urine. Blood tests that show elevated BUN and creatinine. Hopefully you know that BUN and creatinine represent function of what organ? Hopefully you're thinking the kidneys. So decreased kidney function would cause elevated BUN and creatinine. Decreased glomerulofiltration rate, or GFR, would show the kidneys not working well also. Sometimes there's an elevated ASO titer or an anti-streptolysin O level that shows a recent strep infection. Nursing care is going to be supportive. We're going to monitor blood pressures, eyes and nose, daily weights, and restrict sodium, potassium, or fluids as ordered. A lot of times if you see an NCLEX style question and it says to hold fluids or restrict fluids, usually a red flag and not going to be the correct answer. This would be one of the exceptions. With acute glomerulonephritis, the body's not filtering fluids like it should, so it's possible that one of the orders would be to restrict fluids. Other medications could be ordered, such as diuretics, antihypertensives, or antibiotics. And we want to watch for complications like circulatory overload. So you want to think of your signs and symptoms of fluid overload, as well as acute kidney injury, just basically something causing the kidney not to work correctly, in this case glomerulonephritis. And here's a nice little visual that goes over sort of the cause and some signs and symptoms of glomerulonephritis that you can pause and review. Next up is nephrotic syndrome. Alterations in the glomerular membrane allow proteins, especially albumin, to pass into the urine, resulting in decreased blood osmotic pressure, which leads to proteinuria, hyperlipidemia, and edema. Nephrotic syndrome happens when the glomerular membrane becomes leaky, letting protein escape into the urine. Without protein in the blood, fluid leaks out into tissues, causing major swelling. Picture protein like sponges in the bloodstream that hold water in the vessels, and if all the sponges escape, the water shifts out, causing edema everywhere. Signs and symptoms include those associated with decreased urine output or fluid retention, such as weight gain, edema or swelling, especially around the eyes, around the abdomen, which is known as ascites. Might also see frothy urine, which is indicative of protein in the urine. Murky lines, it's hard to see in this picture here, but they're white lines that go across the nails horizontally, is a sign or symptom we might see. Pale skin, anorexia, diarrhea, irritability, lethargy, vomiting, dyspnea, and also dark, frothy colored urine with that decreased urine output. In terms of testing and diagnostics, we're going to see significant proteinuria, protein in the urine with nephrotic syndrome. Also, those labs that tell us how the kidneys are functioning are going to be elevated, specifically BUN and creatinine. Serum albumin is often low because albumin is a type of protein that escapes the blood and is excreted with urine. Unique one here, total cholesterol and triglycerides are typically increased with nephrotic syndrome. And a definite diagnostic would be a renal biopsy, where they take a sample of the renal or kidney tissue and study it. Nursing care has a heavy focus on monitoring fluid status. We're going to look at daily weights, strict I's and O's, monitor edema, and sometimes there may be fluid or salt restrictions ordered for the patient. Medications include corticosteroids with, those, they end in SONE. Prototype one here for you is prednisone. Diuretics like furosemide, brand name of that is Lasix. Albumin infusions, which are plasma expanders, and sometimes immunosuppressants. Education is huge. We want to teach patients and their families about risk for infection, especially if they're on corticosteroids. Get dietary consults as needed, and discuss the need for vaccinations like the pneumococcal, holy moly, I got it out, the pneumococcal vaccination. Last, genitourinary condition here, hemolytic uremic syndrome. Hemolytic uremic syndrome is a triad, three components there. Acute kidney injury, hemolytic anemia being decreased red blood cells, as well as low platelets. So acute kidney injury condition, or acute kidney condition caused by acute kidney injury, hemolytic anemia, and thrombocytopenia. With hemolytic uremic syndrome, the endothelial lining within the arterioles of the glomeruli become inflamed and cause red blood cells to clog the kidneys. This leads to intravascular coagulation. It is usually caused by an E. coli infection that produces toxins that damage red blood cells and clog the kidneys. It often follows a GI illness with diarrhea. Kids may present pale, swollen, bruised, irritable, or even have seizures. The symptoms might follow an episode of diarrhea and vomiting associated with an E. coli infection. Labs include CBC, urinalysis. We'll look for elevated BUN and creatinine, indicating the kidneys are not functioning well. We'll also look at platelet count for thrombocytopenia, which would be low platelet numbers. Nursing care is supportive, monitoring I's and O's, fluid replacement, blood transfusions if necessary, and if the kidney isn't functioning well, the patient may even need dialysis. Education would involve avoiding E. coli exposure, like undercooked beef, and not using antidiarrheals in this case because we want the infection to be processed out.